to go through to pick out your own teeth. I mean, what a concept, right? You know, you get to pick your own teeth, and looking at the different styles of teeth and how your smile might be different depending on what your choices are. Wow, that's my kind of shopping, you know? For better or for worse, in our culture, beauty is power. And you have a very different impact in terms of persuading people, selling your ideas, influencing people, depending on how you look. So I think it's made a tremendous difference. Certainly, I'm more self-confident than I was. And I think I'm having a better impact on people, honestly. And my husband loves it.
And see, once the work was completed, I was just ecstatic with the way my mouth looked and my smile, that I thought, why didn't I do this 20 years ago? But 20 years ago, things were different. People weren't thinking along this line
So,
of a great smile.
One of the things that really was a limiting factor for Sandy with her braces was they did align the teeth, but the teeth weren't the right color, in my opinion, to really, especially with her skin tone, her hair. If we pick the shade that we did, which I really love, it just really complements her whole face, brings out the sparkle in her eye, and really complements the skin tone very nicely. And with braces, you could do all you want, bleach all you want, you're not going to get that. So veneers then become the option in changing that tooth color to really match the face.
Well, I chose him because I thought he was very good. His first meeting with me was a substitute with another dentist, and I chose Rodney. And
That's been 17 years ago.
It's been a long time ago. And I have been with him ever since, and I feel I'm almost one of the local people here. I'm here so often.
It definitely has made you look younger.
Mm-hmm.
I mean, you're very attractive, and you look young. This even complements that even more. I mean, for me, I really see that in your face. Mm-hmm. Before you're with the other smile, you had the wear, which I know you didn't like. You had the extra gum, and it just didn't match your personality. It just didn't.
Right.
And I for one see that this does match you. For sure.
Absolutely. I mean, it's with the other ones that were grinding down, I would see pictures of me and think, oh my goodness, you know, I look like I've aged 20 years, and this is really, I think, you know, giving me a facelift.
All right, you know, I'm almost disappointed how much time I have with you. The more I learn about this, the more interesting this is becoming. Now, as we talk to your patients today, they're all different ages, but I'm starting to realize that I talked to you a little about, and you did, about plastic surgery, about people that have their face physically altered. And you said it's best to start with their bite.
That's right.
And I thought, well, what does your bite have anything to do with your face? But reconstructive cosmetic, you actually give people back the face they had size-wise when they were younger, because as your teeth collapse, you get that old look.
Well, it's not just that with age, but it's also some people's just the way their bone structure is and the way their teeth develop, that they have a collapsed bite. And many people don't like this.
So you could be born with it.
Absolutely. And they don't like their smile, and there are things about their smile they don't like, but they don't understand it to the degree, obviously, that I do. So one of the key parts that we evaluate when we look at an aesthetic case, and when we say, I want a beautiful smile. I don't like my smile. What can you do for me? One of the key steps that we look at is, where's the position of the teeth, say the lower teeth in comparison with the top teeth? Are they in a good position? Are the bones in a good position? And is this also potentially causing pain associated with muscles and headaches, like we talked earlier?
Right, but I'm still stuck on the part, and I mean, these people come in, not only do you give them bites, that get rid of the pain we were just, they look beautiful, talked about being the center of their face, but you actually, by doing this and doing the reconstructive cosmetic, by rebuilding that to where it should be, whether it was, you were born there or wore down, you can actually make them look younger, feel younger.
Yeah, it does. If you have your bites collapsed, say if the top teeth are fitting completely over the lower teeth, you've collapsed the vertical dimension, meaning that your face vertically is shorter for its width than it should be. And
kind of like when grandma or grandpa used to take out their denture and they'd have that, and we all laugh.
So by just opening that up, even, you know, some cases we open it up maybe ½ an inch, which is, it seems like an extreme amount. Many cases we're opening it just a little bit. But not only will it enhance this overall smile, so when you smile, you can show more teeth, but that open up vertically helps the whole face to keep the right proportion. And
you wouldn't think of this. We were talking about the front teeth don't chew, but you were talking about when you open that up or you make more room in there, there's actually room for the teeth, the crown, everything to go in there versus just trying to wedge it into the room that's left. Because my experience, if I go to the dentist, I go like that, they make me a crown, would fit in that little hole, whether it was my teeth overclosed or what, they're just going to fit it. Is the schooling, is all the extra work, is all the extra time led you to the point where, I mean, I met an 83-year-old man today that looked like he was 65 who's got all his own teeth.
Right.
And you've been working on him for, you know.
Close to 20 years.
Right. I mean, he looks young, he obviously feels good, he's in great health, but it didn't really dawn on me until I looked at him that being able to achieve that symmetry in the face makes him look a little younger. Having that beautiful smile makes him smile more, which makes him appear younger. And they just seem to be in better, I don't know, overall spirits than people that I've met that usually have dentures. Is it that big a deal?
Oh, it is, especially if it's not handled well. You know, there's two components when we start addressing smiles, is the aesthetic part of it, but also function. We want something that's going to be functional. We want it to last long term. So we're looking at for aesthetics for not just the smile, but the whole face, but we're also wanting long term the teeth to hold up. We don't want failures to start happening 10 or 20 years down the road. If the bite's not handled right, if we don't have that room, if things are over collapsed, you're going to have long-term problems, either with the back teeth or then the front teeth that we may have restored with, say, veneers, start cracking and fracturing because the real problem wasn't addressed with the back teeth. And there's a lot of problems that can be associated with it. It could be collapse from loss of teeth. It could be genetically, like we mentioned. So there's a lot of complexities that play into this, but it's something that I understand and have been trained in so that we can address those things when someone says, I just want a prettier smile. Well, it very often is more complex than just getting pretty teeth in the front.
Without upsetting anyone, and sometimes I ask questions, would you say it would be a good idea if you were thinking about having some kind of plastic surgery done on your face, because obviously it's not make a difference anywhere else in your body, before you do that, you might want to go to somebody that does what you do and see about getting that bite rebuilt to see if that won't help you before you go? Well,
absolutely. You know, you want to put things in the right proportions. So there's, you know, you certainly don't want to start looking at all the soft tissue and then address the teeth after the fact. And then we find out, you know what, we need to open things up a ways. And then your face is out of proportion. So we handle the teeth first, then the tissue, the soft tissue on the outside can certainly be dealt with. Also, I'll just say this, is in my opinion, and just dealing with a lot of patients that have dealt with their smiles and maybe had a few things done with their face, they felt like they got more money for their, kind of bang for their buck, say, with dealing with their smile than they did dealing with eyelids or chins or cheekbones.
Now, the difference, and I may be wrong here, and if I am, correct me, but my understanding is that when they do plastic surgery and they cut, over time, you have a tendency to go back. With the bite, if you get it right and you get it fit, and you pretty much they're going to live with that. That man was 83 years old, still has all his own teeth.
Yeah, the quality of the work that we can put in today, I'm confident we can put work in today that will last someone their lifetime if it's done right and the bite's handled well. And the materials are that good. As long as we put things in harmony with the bite and the teeth, they'll hold up and last. We don't get collapse, we don't get failure, we don't get breakage of porcelain because everything's in harmony.
My whole life has been worrying every day, not just at some point during the day, but like almost every hour I would have some thought about how embarrassing my teeth were. It was just really bad, and so I was very cautious about where I smiled, and Dr. Gleave has had a reputation, it's not just from what I've gathered, but from everyone, that he's the best dentist that there is, and so I wanted to look good, and I was willing to go through the efforts, and finally, when we finally made the decision that we were going to do it,